So, good morning, everybody. And sadly, we lost two more Albany County residents to the virus, a woman in her 70s and a woman in her 80s. My condolences to the family and my prayers to the family and to the other 147 families. And, our prayers and thoughts are with you in these difficult times. So, again, it's here, people, and it's affecting people on a variety of different levels. So please take a moment and think about the families that lost loved ones since this began over 8 months ago. So today marks 252 days and 36 weeks since we started this on March the 13th. Tomorrow will start the 37th week as we continue to move forward. And as of today, we have 4,669 positive cases of the coronavirus in Albany County, 1,881 people under mandatory quarantine. Today, we have another high of 96 positive cases overnight, 96 positive cases. We've had 1,103 new positive cases since November 1st, over 1,000 since November 1st. Of the new positives per day, we know that 37 had a close contact of a positive case, 10 are healthcare workers, 4 people are reported traveling out of state, and 46 people don't have a clear source of infection. 19,482 people have now completed quarantine, and 3,949 of them were positive cases, and we have 26 recovery as of yesterday. So here's the other big issue we have, and it's a thing we talk on the control room twice a week now. And we look at hospitalizations, we look at the numbers going up, and as of today, we have 44 people currently hospitalized, 10 new people overnight. With the hospitalization rate at 0.94% of those who have tested positive. Yesterday, that rate was 0.87%. 11 people currently in the ICU. Yesterday, that number was 10. Over the last 5 days, there's been an average of 87 new positive cases each day. Yesterday, it was 82. We continue to keep an eye on our percent positive rates. On November 16th, we hit 4.5%. But our average over the last 7 days has been roughly 2.49%. And keep in mind, in order to consider a microcluster for Albany County size, you need a 7-day rolling average above 3% for 10 days. That would put us in the yellow zone. And we're still not quite there yet, but we're getting there with these numbers going up. You know, when we talk about the seriousness of the situation, we're not just talking about the numbers of cases or percent positive rates. What ultimately matters is the hospital numbers, because remember that when we enter this point of flattening the curve, we first hit with COVID-19 when we're looking at flattening the curve. We have more positive cases lead to more hospitalization, which sadly can very likely lead to more deaths, which I do not want to see. And that's why we continue to preach about wearing masks, coughing into your arms, cleaning your hands, and staying 6 feet apart. We also keep telling people that's the reason why we're saying, and Dr. Whalen and I continue to put the message out there and beg people, don't go out if you don't have to. Don't do anything unnecessarily that you don't have to do. If you can avoid going out, avoid going out. Please do the right thing, and we'll get through this until we get the vaccine in our hands, until we start getting it out. We're going to be in this situation, and we're going to be in this situation for a few more months. I don't want to scare people, but we're probably looking about May of next year before you see any light at the end of the tunnel. So mentally, try to prepare for that. I've said this before in the beginning. It's a marathon. It's not a sprint. That we need to be in this together. And the only way we're going to get through this is together. And, unfortunately, some people get it, and some people don't. Some people feel they have the right to do what they want to do and socially gather and not wear a mask and not care. Well, I think about the 149 people that passed away in the county and the lives that we can save by working together. By working together, the people we can save. And we need your help. I don't know how else to put it. I don't know how many times we can sit here and talk about it. Listen, it's a situation we're in, and You know, we got to let the healthcare do their job. We have to try to continue to keep the hospitals freed up so they don't stay bogged down. And we need to be there for the residents. So please help us. Please help us. With the 44 Albany County residents currently hospitalized from the virus, we now have the highest number we've ever had since the outbreak. The highest number since the outbreak. We had 43 people back on April the 28th, was the highest peak we hit of Albany County residents in the hospital. We're at 44 today. We also now have the highest number of patients in the ICU since April 15th, when that was 12 people. So the second wave's here. It's not going away. And just turn on your news outlets, listen to the radio, and it'll tell you everything going around in the state of New York and around this great nation of ours. El Paso, Texas, it's sad. I don't even want to get into it. Watching it was like New York City in the early stages. You know, we're watching people from all around fight with hospitalization, overcrowding, not having the resources, doctors and nurses being burnt out from being on the front line, and we still got a long way to go. It's important to remember that our hospitals are a regional facility, so that means people from all over the region come there. Albany Med is a trauma unit, and Dr. Whalen can talk more about that, but they just don't get patients here in Albany County. We can't allow our hospitals to become overwhelmed, so we need to continue to do the right thing. As Governor Cuomo said in the beginning, you know, this helps not have a surge in our hospitals. And having 44 people in our hospitals now, in our ICU, as high as they are, and 2 more people that passed away, we need your help. We need your help. Now's not the time to debate and fight if it's real, if it's not real, or you don't need this, you don't need that. Please just do the right thing. That's all I want you to do. Do the right thing. Help us get through this. And if you do the right thing, we'll get through it. You can argue a year down the road when it's gone. Let's sit outside, have a big picnic, and we'll discuss everything, and we'll discuss what was right, what was wrong, who is factual, who's not. But again, it's about saving lives. And the only way we're going to save lives is by everyone buying into this. I've said it before, don't argue with people who don't want to wear masks. Just stay away. If you're out at a business or a restaurant, please, by all means, don't go there if they're not doing the right thing. We can continue to educate, we can continue to tell people to do the right thing, but if they're not, you have the right to walk out of that establishment. Don't do it to yourself. Don't get yourself angry, and you can't fight with stupid. How about that? You can't fight with stupid. So just walk away. We should think what's happening in other states, because I don't want it to happen here. The state provides these charts on Monday outlining the Capital Region Control Room and hospitalizations per 100,000 people, the rest of the state of New York. Capital Region is the blue line. If you look at our hospitalizations compared to everywhere else, we're one of the top tier, and it's not a place I want to be. So that was based on data before the 96 and a few other ones, so I imagine that number's even higher. And I believe that, if I stand corrected, Dr. Whalen or Mary, I believe that was before even the 2 deaths today. A month, yeah. So one day. So that chart is going to be even higher. We do our best to put the data together and get it out there, but that chart is going to be even higher than what you're seeing now. And if that doesn't scare you, think about that blue line being even higher. Since October 20th, our hospitalizations have passed New York State as a whole. The next chart shows us the same level as the Finger Lakes Control Room region, but less than the Southern Tier Control region. Now look at these numbers at places like Western New York, a percent positive rate of 6.5 yesterday, Central New York at 4.5%, Mid-Hudson Valley at 4.3%. We need to be proactive, make small sacrifices for the greater good of our community. It's not that hard. I know it's been a tough 8 months. Trust me, Liza and I talk all the time. We agree to disagree. We're tired. But we still got to show up every day and do our job. We still have to continue to get our mission out there and accomplish the services that we do and protect the residents of the county. Just help us do that. Help the people the essential workers that have to come to work every day, continue to do it, but try to do it in a safe manner. Please, we need you. We need a buy-in from everyone. And I know the Capital Region as a whole has been good, but we're slipping. I know we got fatigue. I know everyone has fatigue. And you look at Halloween, our numbers went up. And with Thanksgiving around the corner, do we continue to go up? I'm hoping people aren't traveling. I'm hoping people aren't going around. And I hope they're abiding by the rules. Like I said, you can celebrate this 8 months from now. Just a turkey. That's all it is. You can do it down the road. So, please, this means going out less, avoiding large gatherings, wearing a mask out in public, socially distanced, and coughing into your elbow. One of the best tools we have to beat back this virus is getting tested. So again, I want to remind everyone, UAlbany's free. It's free. You can call UAlbany, you can go to our website, but also we have Whitney Young, Price Chopper, Walgreens, and many other places. As you can see, the ones that is closest, as well as which ones provide testing for children, the average wait time for results, which we launched yesterday, the app that you can go to at albanycounty.com. Listen, it's, you know, we hope, I know we've gotten stories, people waited an hour, some people got told to come back. You know, look around. That's why we put this together, to give you an opportunity to look at other places that you can get into and get out of quicker. Please get tested, especially if you have signs and symptoms. Do the right thing, and we'll continue to get through this. You know what? You do know that they do require appointments for the walk-in, so double check that the details before you head over to get tested, so you know, so you don't get yourself aggravated or mad or ticked off at the lady or gentleman just trying to do their job at the front desk. You know, again, look, they're just as stressed out as you are. So please continue to do the right thing. You can call UAlbany at 1-888-364-3065. Our Whitney Young, great partner, you can call them also. And please call for an appointment at Whitney Young at 518-465-4771. Dr. Whalen.
Good morning. So as the county executive indicated, we are still seeing a concerning rise in numbers and urge members of the public to remain vigilant. In particular, the numbers of hospitalizations that we're seeing are concerning, and we want to again reinforce the important information that what we are doing now is to prevent hospital surge capacity. We do not want to see in Albany County what we have seen in other counties throughout the country, with concerns around hospital capacity to be able to handle sick patients. So from that perspective, there's two important things that you can do. The first, of course, is the importance of all the guidance that we have given around COVID, around avoiding large gatherings, around wearing masks, around really considering whether what you're doing needs to be done, or whether you can do things at home, whether you can work from home, et cetera, and frequent hand washing. The second is, again, I'm going to stress the importance of getting your flu shot and getting flu shots for everyone in the family. Again, flu shots are a recommended strategy for everyone over the age of 6 months. They are widely available. We do start to see hospitalization upticks from flu at this time of year. That would not be unusual, and again, we need to be able to keep as many people out of the hospital as possible so that our hospitals are able to serve the people that need service for medical emergencies, for trauma, and of course for COVID. So if you're sick and you need to go to the hospital, go to the hospital. But if you can engage in preventive behaviors to prevent yourself from getting so sick that you need hospital care, please consider that now. And again, what you do today will influence what happens not only to you, but to your family and to the community in the coming days and weeks. So this is very important behavior. When we look back at where we are now compared to where we were in March, there's a couple of concerning differences, and we are entering into a flu season now. And also we are looking at a real commitment on the part of our state and federal partners to try to keep kids in school. We know that it is difficult for kids and families and society when children are not able to be in school. And as I've indicated many times, the school districts are doing what they can within the context of the schools to protect kids. Parents need to be mindful of what they're doing outside of school, and sometimes this does involve sacrifices. Again, I know I've stressed I'm a mom of 3 teenagers. I know parents are having concerns around kids that have been placed in quarantine, and are they able to go to, sports functions? These things are all very important, but these are sacrifices that right now need to be made for the greater good. So, I would encourage parents to really join us in that very important effort. And explain to your kids why this is important for the greater good. It's not an easy message, I am aware of that, but it's a very necessary message at this point. We continue to encourage testing. Testing is really the cornerstone of our response. If we test, we know where disease is and we can better control it. So if you are having symptoms, even if they just happen to be symptoms of a minor cold, please consider getting tested. Testing is available in many places, and as you just saw, we see that on our website. Not only the places you can go to get tests, but the response time, which I am very happy to hear is available for people to look at and guide their testing strategies. We're working closely with the schools to kind of prepare for what happens if we do find ourselves in a microcluster zone, and the schools are all actively preparing and planning on the testing strategy that will be needed to be implemented if we get to that stage. It's dynamic. Every day there's a new set of challenges and a new collaborations are being formed. Again, the relationships that the county and the health department have made with our healthcare partners, with our schools, with our federally qualified health center at Whitney Young, all of these things now are coming into play and helping assist us in our response, helping us to help you. So we encourage everyone to continue to play your own important part in that essential response. Thanks.
Thank you, Dr. Whalen, as always, for everything that you do in our community and continue to do. So, just to switch gears a little bit, we still have to move forward, right? Kids need hope. We did the Toys for Tot drive at the Haka facility, and we have adopted family that we get a lot of presents and stuff out to kids on Christmas and throughout the month of December. So please, this Saturday from 10 a.m. To 2 p.m., you can do a drop-off at our overflow parking lot at the True Hotel near Crossgates Mall. Socially distanced, don't have to get out of your car. So we're asking people, to do the right thing, but stay in your car, just drop it off and drive through to make a difference in someone's life. You can go to the website at albanycounty.com or Department of Children, Youth, and Family, where there's adopted family information and what kids and people are looking for. Also, please, our mental health support line is still available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. It's also set up for children, so if you have issues, parents take the opportunity, talk to your child. Think about the stress level that you're feeling and how quickly sometimes you're snapping over the littlest things, and take a moment to put your outlook in a 16-year-old's eyes, or 18 or 19 or even a 12, that their whole life has changed. And Liza brought up a good point about sports and everything else, and I feel bad for these kids. It's their last year. Some of them are seniors. They won't have the opportunity to ever play in college, or this is it for them. And this is how the year ended for them last year, and this is how it's going this year. But it's better than the alternative. And I know it's tough as a parent watching my kids play sports. I get it. Or hoping that they get that scholarship to college to go play, or whatever it may be. I feel for you. But the alternative is people continue to get sick, go in the hospital, and die. So please do the right thing. I know we'll get through this. And hopefully someday we can look back and just, as a distant memory of what we're going through at this point in time in life. So please continue to do the right thing. 24-hour sexual assault hotline number, 518-447-7716. Our United Way 211 in the New York State hotline. Again, please do the right thing, stay safe. Any questions?
How are the hospitals doing capacity-wise, seeing as there was such a large number today, especially with PPE to, what is their status? I don't know if that's something you could answer or not.
I don't have moment-to-moment information on that. I haven't heard that there were any concerns around surge capacity, but I would direct those questions to the hospital.
For Dr. Whalen, it's generally understood, and if I'm not mistaken, that there is a 10 to 14-day lag between when the infection rate goes up and when the death or ICU rate goes up. Is that correct?
Yes.
So that being said, compared to earlier this year, when are we expecting the death rate to go up, or are we, because treatment has gotten better over the past few months?
Well, you know, as with everything COVID-related, the data evolves and changes over time. We know that once someone contracts COVID and becomes ill, it can be a prolonged period of time that they are sick and ultimately succumb to the disease, and that's why that statistic of 10 to 14 days is usually used. But also, there are, you know, new developments in terms of treatment that have caused less mortality, but the bottom line is we really don't know. We don't know when the death rate will go up. It depends on who is becoming sick. We know that the majority of deaths that we've had in Albany County have been individuals in their 70s, 80s, and 90s that had underlying health conditions. So we know those particular individuals are at risk. We know that you know, trying to keep those individuals safe is certainly a priority, and that's why it's important when we talk about, you know, for example, Thanksgiving celebrations, that people consider the health of their relatives that may fall into those categories around potential exposure. You could have a completely asymptomatic child that would infect a grandparent and you know, cause this to happen. But really, these are trends that we continue to actively follow and monitor, and we learn more about it every day.
Concerning Thanksgiving for the county executive, between now and then, will Sheriff Apple be around to explain how enforcement will work? I spoke to Steve Smith yesterday, and he said they're not doing patrols, but they're just responding to calls for service in relation to capacity. Do you have any idea if the county response is going to be similar to that?
So that's a great question for Sheriff Apple, but him and I have talked about this. It does fall down on the sanitation code that the governor put out on the 6th of October. It falls down to the towns, cities, and villages, first and foremost. Then the sheriff would assist if they need to be, but it would fall down to the city of Albany to go out first to investigate and then call us in if they needed to. But I'll remind everyone of this, and I know this has been the hot topic about Thanksgiving. Hospitals, 9 out of the patients that are in the hospital are between the age of 25 and 49. There's 21 between the age of 50 and 74, and then there's 14 that are over 75. So it is affecting people at all different levels, and you're seeing younger people now being hospitalized, which is scary. So I'll say to the parents and to the people that want to get together, just wait, you know, do it via Zoom and do it down the road. It's nothing that has to be celebrated on that day. I know everyone wants to get together with their family, but help us do the right thing, please.
Same topic for Dr. Whalen. Steve also said that the Department of Health is the enforcement agency, and I don't know exactly what that means. Is that correct?
The Department of Health does not have the staff to be out patrolling. We look to local law enforcement for that.
That goes to the sanitation code the governor put out in the guidelines on the 6th of October, that they changed the fines and fees that make it possible for the towns, cities, and villages to enforce it, not the county.
Okay, and when it comes to staying home and the directive to minimize unnecessary activity, that sort of runs counter to the sustained local business argument and the restaurants that are essentially struggling through the winter. How do you balance those two narratives of support small business and minimize unnecessary activity?
Do takeout.
Yes, thank you. Dr. Whalen beat me to that. Takeout, yes. Continue to support them the way you were. Curbside pickup.
Okay, and any additional information in the regional control room calls about the vaccination program? That still seems to be something the governor is talking about on a daily basis and kind of up in the air.
You know, Dr. Whalen has said this most eloquently, better than me, that there's a plan in place for our health department, our medical corps, to work within it, and we're going to continue to get ready to get that vaccine out when we get it. And I'm also working with the other county executives and county managers across the state of New York, what that's going to look like in a partnership going forward. And obviously, the governor will be putting out the way he feels it's best to get it out to different communities. And I think he made his point known very well I think it was over the weekend, when he said that he's going to make sure it gets to the communities that this affected the most, first and foremost, get it to nursing homes and to the communities that affect it, and then go from there. So there'll be an overall plan coming out from the governor, and obviously our health department will be working with the state DOH and already implementing what we have in plan to go forward.
Last one, is the sheriff going to be here between now and Thanksgiving at one of these briefings?
Yes, when his 14 days is up, or 8 days, whatever it may be. All set? Any other questions? So again, please, I just want to remind everyone to continue to do the right thing. We'll get through this. I know it's difficult. I know people are out there hurting, but again, try to walk in their shoes, try to look at it from their point of view, and we don't need to argue with one another. We just need to be there for one another as a community. Now more than ever before, we need to be there, and we can be there for each other. Again, you just got to understand, people have a threshold of pain differently than other people, and just because you can tolerate more pain than someone else or deal with a situation differently doesn't mean I don't want to say Dr. Whalen, because I know you're up there with me. Doesn't mean the person next to you feels the same way, and little things can offset them, and especially in the workforce and at home, and we need to do it together. And I know the stressed parents are under trying to educate their kids at home and trying to do their job and educate them. And parents with kids with disabilities, we do continue to address that issue. I'm behind you 100%. These kids need in-person contact. They need to be there, and we need to figure this out and need to be that support group. But again, thank you to everyone out there for doing the right thing. Continue to do the right thing, and we'll get through this. Thank you.